Hey, everybody, welcome to The Blacklist, the show where we interview the elite. Today's a treat because we have Deven Patel and we have Dr. Anand, and they're both co founders of Geostar. And today we're going to get a lot into their story, what is stem cell therapy, their recent exit. Is that correct?
Acquire.
Acquisition. Sorry about that. And for people that don't know you, right, this is their first time listening in, first time ever seeing both of your faces. What is it that Geostar is, and what is it that both of you guys do?
So, Geostar is the full name of Geostar is Global Institute of Stem Cell Therapy and Research,
Yeah.
and that is a California, San Diego-based organization. And the work of Geostar is to develop the stem cell-based
Yeah.
regenerative medicine.
Okay, and then for people that don't know what stem cell therapy is, actually, my uncle had some of that because of his back. Something happened to his back, but he needed stem cell therapy. For most people that don't know what that is or just unfamiliar, what is that?
So, this is very good question actually.
Yeah.
So, stem cells particularly, we know that our body is made of different organs.
Yep.
And working at University of California, San Diego Medical School in 2000, I was thinking how we can manage so many kind of metabolic diseases.
Yeah.
And when I say metabolic diseases, the diseases which arise inside the body just because of the malfunction of the different organs.
Okay.
So, and there's no treatment till today. You will be surprised to know.
Yeah.
Till today, there is no treatment for any kind of metabolic diseases.
Wow.
That is only the management through different kind of medicines and other things.
Yeah.
Then I was knowing that there is a master cell in the body, and that master cell makes entire body.
Yeah.
And then what is that master cell which makes entire body? Is the stem cell. And body is nothing but the combination of different organs.
Yeah.
It means stem cells is making each and every single organs.
Okay.
Then I thought, is it possible to really bring these stem cells in the lab and try to differentiate these stem cells into lab to see inside the lab, is it possible to make different organs or tissue or not? And that's the start of the story of the stem cell science.
Yeah.
In 2000 at University of California, San Diego Medical School with me and few of my colleagues.
And how did you guys get find each other?
So we are the partners. I'm the CEO and co-founder of Geostar, which is Global Institute of Stem Cell Therapy and Research based in San Diego, California.
Yep.
And Dr. Anand is the chairman and the co-founder of Global Institute of Stem Cell Therapy and Research, known as Geostar.
Yeah.
And we met together in one of our Indian temple, and that's how this whole journey of healing started.
Yeah, yeah. Well, number one, that's powerful because I don't think too many people know about this type of stuff. And number two, it's crazy how small things like finding each other, and then all of a sudden it's like now this is a big, big company, right? I've seen you a lot on TV, and this is my first time meeting you, so it's very good meeting you. But I mean, out there, he called you, I think, the godfather of like stem cell therapy and things like that, right? So it's very good meeting you both. Right. Now, walk me through the recent acquisition that you guys had, because I know it's a big one. So walk us through how that happened and why.
So we have so many technologies in Geostar, and Geostar is a parent company which basically creates all the new technologies in field of stem cell science, gene therapy, cancer research. So one of our company called Geo World Health has been acquired on Wall Street for $250 million. We just made an announcement on March 8th,
Nice.
2023. And that company will be now creating a blood out of stem cell.
Oh, wow.
So we have a lot of red blood cells
Yeah.
from stem cells. So because that's a huge need, it's about 100 plus million unit shortage every year.
Okay.
And people need a blood. So we're creating an O negative universal grade red blood cell. Within that company, we will have stem cell treatment facilities that we will be expanding into the outside of United States. We will be creating active skincare, which is basically stem cell based skincare, which is most powerful and effective.
And how does that
skincare.
happen? Is that for example, when people get burns and they need stem cell therapy?
Yes, that is for burn is even more advanced. This one is just a regular skincare for getting rid of your wrinkles, looking young and
Ah, okay.
fresh.
Yeah.
So many things we are doing, but the most important part of this deal was making blood out of stem cells, red blood cell, and creating a stem cell treatment facility outside of United States.
So give people, if possible, give people a list of what stem cell therapy can do for each part of the body. Like, how important is it, the work that you guys are doing?
I just wanted to, we also call it a regenerative medicine. Stem cells for
Regenerative medicine.
regenerative
Yeah, yep,
medicine.
yep.
So anything that degenerates in your body, stem cells' job is to regenerate. That's why it's called regenerative medicine.
Yeah,
And Dr. Anand Srivastava being the pioneer who started this field 22 years ago, the modern field of stem cell science.
yeah,
So I would let him answer that question.
for sure.
No, this so as I told that entire body is made of stem cells,
Yeah,
but body is nothing but the combination of different organs. So, and I told that I myself was not knowing that if you take how to take out the stem cells in the lab, how to
right.
culture it, how to make several stem cells, and is it possible to really to differentiate these stem cells into different kind of tissues or not? So first time I showed that yes, you can differentiate these stem cells into the blood cells as Deven told,
Yeah,
and then I showed first report that you may repair the damaged brain using the stem cells, because before 2006 or 5 it was known that if brain is damaged or neurons are damaged you cannot repair,
right, right.
and that's what I use the stem cell to see if really brain can be repaired or damaged neurons can be repaired.
Yeah,
So I showed, and that was published in topmost journal called Stem Cells, and that's changed
yeah,
the
that
entire
changed a lot of
field
things.
of
Yeah,
the stem cell science. And then I showed first time that you can manage autoimmune disease, like you just mentioned in
yeah, yeah.
beginning of this talk that uh, can you manage some inflammatory diseases like inflammation or arthritis and all these things. So these things are coming because of inflammation.
Yeah.
So there are different kind of stem cells. So I do not want to go in too deep about
Right, right.
classical and classification of different kind of stem cells. But right now we are mainly using most modern stem cell, and those are adult stem cells. And so these particular stem cells has very specific character. And these stem cells, the wonders of this stem cell, and particularly given by nature, and that's the
Yeah,
beauty of the nature, that it's already in our body. But with aging, these stem cell goes down.
yeah,
Okay,
yeah.
and then because of the it's going too much less with the aging, so it doesn't have that much capacity or number to repair any damage, and that's what we are putting
Mm,
the stem cell from the outside. So this particular stem cell which I am talking,
yep.
this particular stem cell has ability to go to anybody's body. You don't need to match it.
Oh, wow.
So like I can give my stem cell to you,
Yeah,
you can
yeah.
give your stem cells to me.
Oh, yeah,
And
that's revolutionary. Yeah,
so that is the first character of this stem cell.
yeah.
Second character, these stem cells are immune competent. It does not rejected by the immune system.
That's good.
And third, more important character of this stem cell, which you told that how it can it manage the sport injuries and all these things or joint problems.
Hmm.
So these particular stem cells down regulates the inflammatory genes actions
Yeah.
and inflammatory cytokines. Those are the inflammatory chemicals in the body. So it blocks that. So once it blocks that, then inflammation is gone
Right, right.
and the repair starts.
That
And
makes
these
sense.
stem cells also secretes the molecule which enhances the damaged organs or regeneration of the damaged organs.
Yeah.
So blocking the inflammation and regenerating of the damaged organ.
Yeah.
So that's what this stem cell is, extraordinary stem cells and very safe.
No, 100%. Is there another company out there like that is also kind of like in competition with you guys? Because I know you mentioned like he's essentially pioneered it, right? Pioneered it about 22 years ago.
Yeah.
You know a lot about it, which I can tell. And the good thing about what you just explained is you kind of dumbed it down, right? For the audience that doesn't know, you made it very clear what the power of what it can do. So that's good.
There are a lot of companies out there working in this field because it's a 22-year-old field, basically pioneered by Dr. Anand Srivastava and a few scientists in those days.
Yeah.
And nowadays, any country, any university, any governments, they are all into this science because this is basically going to the root cause and creating the cures. So our mission and our vision is very simple. This is the most advanced, elite, and expensive science. We wanted to make it available to the masses around the globe.
Yep.
And we are a hardcore research organization, and at the same time, we have the maximum clinical experience in the world in this field because we've been working in this field for 22 years, and that allows us to bring a lot of solutions to the larger public and a humanity. We are we are gearing up for a lot of clinical trials. Not when I say a lot, it means few clinical trials. Because it's not a lot, but few clinical trials we are gearing up for diabetes, for one of the neurological conditions that we are working on. Also arthritis and few other small clinical trials that we are bringing, and the blood, of course, I told you earlier. And that will allow us to give the humanity how to live disease-free life and age without aging.
Well, I need that for sure. I like that you're trying to bring it to the masses, which is good, because I think people that are listening, they might be thinking like, well, sounds amazing, and it sounds very expensive. It sounds like I'm gonna have to cut off my arm to like sell it so that way I can buy this. How are you making it kind of like readily available to most people? How making it affordable?
I'm glad you asked that question, because that's very important, because as I said, this is most elite, expensive, and advanced science of mankind. How do you make it available to the masses, right? That's a tall call. But I'll give you a real life example. In India, we have our stem cell research facility and a treatment facility. Over there, one electrical pole worker came, and he gets paid, I think, $200-300 a month.
Oh, wow.
And he goes up the electrical pole and come down, and he fell off, and he had a spinal cord injury. Okay. So when he came to us after one year of his injury, we slowly started working on it, and he got slowly certain kind of his abilities back, because he was paralyzed below the stomach. So he cannot tell when he needs to go to the bathroom and all that. So slowly he started feeling the sensation in his bladder, so he knows how he has to go to the bathroom. Slowly he can pull his legs and move a little bit of his legs, so walk around a little bit around the house. So if you think about it, we brought the most advanced science, made it available to a downtrodden person on the earth, and gave the man his dignity back.
100%.
So we made it available, we made it accessible, and we made it affordable.
And to me, in my head, in business, I'm thinking like, how is that profitable? Because he's making $200 to $300 a month, right? So that's that's very low, right?
I'll make in America we all talk about numbers and dollars, and it has to be big.
Always.
My goal, I'm the most feared CEO in the life science, because I'm talking about making it affordable, making it accessible. And I wanted to bring this cost eventually to maybe $5,000 or less. And if you think about it, there's 7 billion people on this earth. Even if I bring this cost down to $1,000, and if you treat 1 billion people a year, that's $1 trillion business. If you know how to do it. And if you have the infrastructure, and if you have the capacity, and you have a scalability, we have it all. We've been doing it for 22 years. I'm not saying I'm going to treat 1 billion people tomorrow, but that's what we are gearing up for. So people can live disease-free life and live their potential and age without aging.
Well, initially, I'm pretty sure it wasn't available to the masses, and it was very expensive. Initially, how did you kind of start offering it to people, or start to bring it down? Because I'm pretty sure like in the beginning, it was maybe not profitable, or just very expensive. So how did that come about?
You see, that's a very good question. But so we design our hospitals in a way that we keep our hospital and laboratory, because lab is the key for stem cells. Yes, hospital is important, but lab is more important, because there you really produce the quality of the stem cells. So once we have your own laboratory, then you are not buying a stem cell from somewhere else. You do your own. So you reduce the cost significantly. And that's what we put a lot of money just making the lab with each center. So of course, initially you need a lot of money. But once you have lab ready, then yes,
you're making it.
I take, because these particular stem cells are basically lying inside your fat tissues or bone marrow or maybe peripheral blood. If somebody is coming and we isolate little bit fat, and then it goes to the lab, which is just next room. And then we isolate the stem cell and reinfuse depending on what kind of disease. I'm just simplifying it.
Right.
So that's the beauty. And the biggest beauty of this stem cell, it is given by the nature to repair our own body. You are not putting any outside of chemical inside your body.
Yeah.
So that is the beauty. And I give you a very good example, actually. You know the COVID, how many people died with it
Yep.
when the COVID-19 came.
Yeah.
Okay. So in beginning, I think 2020.
Yeah, March 2020, if you remember, when the COVID came, 1 month later, April 2020, Dr. Anand Srivastava proposed his solution when nobody knew what to do with it to US FDA, and we're the first organization in the world to get the US FDA approval to treat COVID patients with our proprietary stem cell treatment. Of course, it was emergency approval. It was not a full-fledged approval.
Right.
And we've been able to save some lives. And one of the person that we treated, it was covered in ABC and a couple other news channels. He was in coma for, I think, 4+ weeks. He was paralyzed one side of his body. His lungs were collapsed. His kidney was damaged. He was in dialysis. His liver was gone. But we've been able to help him, and we brought him home.
Yeah.
The guy didn't have a chance.
No, that's a miracle.
And miracle, and I'm telling you, no vaccine, no nothing. And because of my background with the gene therapy and other things, which I don't want to discuss too much here. So I was knowing exactly how viruses work inside the body.
Yeah.
What kind of cytokine storm it creates, which COVID-19 was creating in the lung.
Yes.
And how to suppress that cytokine storm using this particular stem cell, because I told this stem cell down regulates the pro-inflammatory cytokines. So I wrote to FDA, and thank you again to FDA to approve in that dire situation when people were dying, and they trusted on our protocol and give approval within 2 weeks.
Yeah.
Of course, to go for the very serious patient or severe patient who were suffering with this. And fortunately, we saved few. And after that, of course, vaccine came, and that is more important because stem cells, it's still not very easy to go to the
Masses.
100 millions of the people at the same time. But important thing, and the point is here that it helped to the most severe patient.
Yeah.
As Deven told, that patient was under coma.
Yeah.
And that's what I was, and we were, the Geostar was in the ABC News and all this media and everywhere.
Yeah. Well, number one, that's a testament to what it can do. And number two, I think it's a testament to what you guys do as well. You guys don't shy away from that type of stuff. You guys very much believe in this.
This is a difficult field. Science in itself, or research in itself, is a very difficult field. It is, you're always trying to find something new, find cure. And it's not easy. It takes years and years and millions of dollars. Like Dr. Anand Srivastava was involved in one of the key scientists for the first clinical trial approved by US FDA to treat spinal cord injury in human. With Christopher Reeve Foundation, where he was invited to UC Irvine neurology department, working there with the Christopher Reeve Foundation, and they basically opened the gate for the world's first clinical trial to treat spinal cord injury in human using stem cell. And he was one of the key scientists. So there are so many first times and so many contribution of Dr. Srivastava's to this field that today, whole world, any university you go, any country you go, any government you go, they're all working in the field of stem cell science, because now we're talking about going to the root cause and getting the cures. So you don't have to suffer from, so let's say somebody's a diabetic and he's taking diabetic pill. If we can fix that problem, they may not have to take a diabetic pill.
Yeah. And I'm pretty sure this answer is going to vary. But can you give me some examples of how long it takes for, the stem cell therapy to work into someone? Like, for example, the issue with the guy that fell off the pole, right? How long did it take? Was it the entire year of stem cell therapy for him to start, kind of moving again? Or how long does it take? And I'm pretty sure it varies. But give me some examples.
Yeah, sure. You're right. You're right that it entirely depends on the severity of the disease, certainly.
Mm-hmm.
And you are talking particularly for the spinal cord injury, which Deven mentioned. So certainly it takes a lot of time. And again, how severe that is.
Yeah.
In this case, it took almost 6 months. Okay. But if there is some inflammatory problems like pain and a sport injury, or if there is immune-related little problem, then it works within a week, basically.
Yeah.
So it suppresses immediately the cytokine storms or pro-inflammatory cytokines. It neutralizes that.
Right.
So the person immediately gets the benefit or they feel the benefit of the treatment.
Well, what about with the severe, the people that had COVID? That was pretty severe, right? How was that? How long did that take?
Yeah, so in that case, that's again, so that was targeting the pro-inflammatory cytokine storm
Hmm.
created by COVID-19 virus. So you see how the entire thing was designed, and that's what you need real knowledge or research experience. And I'm talking as a scientist
Yeah.
because I don't treat patient. I'm not allowed. I'm a scientist, okay?
Yeah.
So I
Yeah.
talk science. So this, as I told that I was knowing, I published how the viruses goes inside the body and what kind of immune system reacts to the virus. So this particular virus, which is COVID-19, going to the blood and all these things, lung, and creating huge cytokine storm. Then because of that, the lung start filling with the water and several mess up and
Mm.
damaging the lung tissue.
Yeah.
So how to design that?
Yeah.
Because nobody has done ever, okay?
Right.
Then I knew that, okay, this virus has this kind of immune problems. If I neutralizes the cytokine storm created by the virus, it means that effect of that cytokine storm or pro-inflammatory cytokines are not there.
Yeah.
So patient will have the virus, but the effect will not be there.
Right.
Okay?
Yep.
So it cannot damage anymore.
Yeah.
And because of that, there is no cytokine storm, or the cytokine storm was down regulated because of these stem cells.
Yep.
So the lung, the water and all these things which is coming in the lung is not going to come because there is no reaction.
Yeah.
So I confined the virus without killing it,
Right.
like inside a jail.
Yeah.
A-
Yeah.
And
That makes a
then
lot of
virus
sense.
automatically goes away. So the effect of this treatment comes because it goes in the blood, immediately goes and suppress the cytokine storm. So it's like within 48 hours to 72 hours. That's all.
Yeah.
I'll tell you my mother's story real quick.
Yeah.
My mother had an autoimmune disease, psoriasis, skin disease, where
Yeah.
your skin is scaly and dry and cracking and blood coming out, water coming out. And she was suffering from that for a long time. And we brought her into our hospital and we treated her with our stem cell treatment. In 48 hours, her burning and itching, in 3 hours, her burning and itching was gone.
Yeah.
In 48 hours, her skin was almost 90% repair. In 72 hours, more than 90%. Yes, of course, it's an autoimmune disease. It
Yeah.
kind of comes back once in a while. And then we treated her for several times, and she was basically living the beautiful life, no disease, and clean, normal skin like yours and mine.
That's so beautiful. So what's the future for you guys? Obviously, you guys have big goals. But what's the future look like for you both?
We
And with
we
Geostar.
already have a few companies, as Deven mentioned, that Geostar is the mother, then
Yeah.
Geo World, which is going to the public. And we have another Celebration Life Sciences, which is also aimed to do the clinical trials. And we have one hospital at Costa Rica on the name of Celebration Life Sciences. Just we inaugurated
Yeah.
in April.
Nice.
So these kind of things we have. Our main aim is to go to and help the masses who are suffering with degenerative diseases or metabolic diseases, which does not have any answer
Right.
in the modern medicine.
Right.
That's our aim.
Yeah.
Okay, and safest way. The safety is the most important issue, and that must be addressed every single time if anybody is going to touch the human
Yeah.
for anything. So that is what is our aim. Safety, because it's given by nature. Hundreds of publications, including our publications, already demonstrated that this particular stem cell, which I'm talking, that is an adult stem cell, is very safe
Yeah.
to manage or to the human beings.
Yeah.
But how to now cure the diseases, those are the second questions which we are working on that.
Right. Right. Well, it's
And
a
at
big
the
move.
same time, on the business side, we've been working on this technology for 22 years, and we were mastering this technology, perfecting this technology. And now we're at the stage where we've almost perfected the technology or the science. So now we're bringing first time and creating opportunities for public to participate in our businesses and also financially benefited from these kind of technologies. Because all these years, people are asking, are you guys open to take public money? And we're saying, no, we're not taking public money. We are taking all the risk. Now we have taken all the risks. Now we're bringing public at the tail end to reap the rewards in terms of taking this technology to the masses.
So Deven, how many facilities do you guys have?
Well, we're based in San Diego, California. That's our headquarters. And then we have several facilities in India, which are also our research facilities and treatment facilities. We have a Geostar Mexico. We have 3 facilities in Mexico. We have a Costa Rica facility. And we have 10 more facilities in pipeline coming in the Middle East, Europe, South America, and Africa.
Well, powerful message. And I also think it's a very powerful movement. I appreciate you both being on here. Where can people find you guys?
We can find it in www.geostar.com, GIOSTAR.com. Our new company that is going public very soon. It's called Geo World Health, and there are many other businesses. We can't count. There are so many companies that we work because the whole goal is to help people live the disease-free life and age without aging. That's our purpose.
I love that. Well, thank you both for being here.
Thank you.
Thank you very much. That's wonderful talking with you.